Hi, everybody. Happy 2024. I hope everybody's doing well. It's the middle of February already. January was like 1,000 days long, and February now is just flying by. I wanted to get back in the saddle. I haven't been doing a whole lot of podcasting or videoing for the last few months. There's been some changes at work and the holidays. And then my poor sweet mom broke her arm and came and lived in our guest room here / Weber studio. So I got off course, but I wanted to get back into the swing of things. And I was motivated by this movie I watched last night on Netflix called Dumb Money. Don't know if you guys have seen it. It's based on true events in 2021 with the stock market and the Robinhood trading app and I don't know. It's a good movie. It's got Seth Rogen in it and a bunch of other actors, and I just thought it was really good. And it was based on a true story that happened in 2021. Of course, that was during COVID, so I don't know. If you're like me, I don't necessarily remember a whole lot of 2021, but excuse me, I was inspired because the lead character was a YouTuber, and he would just get on YouTube, he'd tie on this funny sash, he'd pour a beer, and he would just go and ramble and talk. And I thought, I just need to get back to this. So hopefully going to bring some good information tonight. Wanted to talk about menopausal hormone therapy and dementia risk, because I get that question a lot, because Alzheimer's especially, which is the most common form of dementia, affects so many people. The Alzheimer's Association says that about 6.7 million people had the diagnosis of Alzheimer's disease in 2023. And the majority of those people are women. 2/3 of them are women. And 3/4 are 75 or older. So it's generally, we're living longer. We're going to start seeing this more and more as the years go by. So I get that question a lot, because I think everybody has someone in their family that they know that has Alzheimer's, or maybe some other form of dementia, but Alzheimer's is the most common. And it can be caused by direct genetic mutations. So if you see somebody that's younger than 60, you certainly see someone in their 40s or 50s that are exhibiting dementia, there can be a direct genetic mutation. I don't know if you guys ever saw that movie that was released in 2014. Sorry, I talk about movies a lot because that's my husband's love language. We watch a lot of movies. But I remember seeing this movie a decade ago with Julianne Moore. It's called Still Alice, and it's a story about this woman who was a brilliant professor, and she developed early onset Alzheimer's. She would get lost on her runs and other things like that. And man, that movie really affected me. I may have to go back and watch it, because it's been probably 10 years since I've seen it. But that would be characteristic of early onset Alzheimer's. And then late onset Alzheimer's is basically going to be 60 and up. And, when you see someone these days at 65 with significant dementia, man, that just seems too young. Even people in their 80s that are otherwise healthy, when you see things like this, like Alzheimer's, strike them down. They just don't seem like they're that old. People are that old anymore. But, we're just living longer and longer, and we just are seeing this. In fact, Alzheimer's Association also said that by the age of 75, it's like 65 and older, 1 in 9 people will have the diagnosis of Alzheimer's. 1 in 9. That's crazy. Anyway, studies are hard to do when you're looking at conditions that don't happen right away. So when we're trying to figure out if menopausal hormones are going to help someone 10, 20, 30 years down the road, that's really hard to know, because you have to wait that long to see if the condition develops. So trying to figure out whether somebody who's 50 at menopause should take hormones, if that's going to reduce their risk of Alzheimer's later, it's really hard to ferret out. And historically, it's been really tough to figure that out too, because the formulas we use these days to treat menopausal symptoms are more natural. So a lot of the studies that looked at Alzheimer's and hormones used a variety of different formulas. And then, of course, we always have women in these studies divided into the estrogen only camp because they don't have a uterus, so they can just take estrogen. And then we have women that still have a uterus that have to have some type of progestogen to protect their uterine lining from the estrogen, which can cause a cancer if unopposed. So it's challenging to say. And then there are some studies these days where they're looking at changes in the brain on MRI, or they're looking at biomarkers in the brain, and they're seeing some good signs in the form of the brain, but we don't know if that form is going to lead to better function. So you can look at something and say, hey, yeah, that EKG looks good, but that doesn't necessarily tell you if in 3 years that person's going to have a heart attack. So you don't necessarily know that in these studies. But in general, findings can be summarized in a few ways. So there was a recent meta-analysis published in the Frontiers, I have it right here, Frontiers in Aging Neuroscience by Neratini et al. It's a systematic review and meta-analysis of the effects of menopause hormone therapy on risk of Alzheimer's disease and dementia. They looked at randomized controlled trials, which are the best types of studies because you have women or individuals taking placebo and you have individuals using or taking the intervention, and then you compare those. So you try to get rid of some of the confounding factors to see if there truly is an effect from your intervention. And then they also looked at observational studies as well. And basically what they found was in the randomized clinical trials in women that were 65 or older, there was an increased risk of dementia in women that were taking estrogen and progestogen therapy. And it was significant. So in the group that was taking, statistically significant, so in the group that was taking estrogen and progesterone, there were 45 cases of dementia out of 10,000 women versus 22 out of 10,000 placebo. So yes, it's statistically significant, but you're talking about 23 more women out of 10,000 or 2.3 women out of 1,000. So you have to also look at that relative risk, meaning how much is the risk increased over placebo, and in this case it's, I can't math, but 50%. So that sounds huge. But when you look at the absolute risk, we're talking about 2.2 or between 2 and 3 women out of 1,000. So that takes the edge off a little bit. In those randomized trials where they looked at women just taking estrogen, there was an increased risk, but it didn't reach statistical significance. And the other thing to think about is some of these studies, women were placed on hormones in their 60s. That's not typically when we're going to start hormone therapy. Usually we're going to be starting hormone therapy in the women that are struggling with those crazy hot flashes, night sweats, vasomotor symptoms. So those are going to be your late 40-year-olds, your 50-year-olds, 55-year-olds, generally the women that are going to be within 10 years of menopause. I mean, I'm not saying that someone wouldn't come in after 10 years and say, I can't take these hot flashes anymore, because we know now from studies that some women, especially Hispanic women, Black women, they may have hot flashes for more than a decade, even much, much more than a decade. And there certainly are women that will still have hot flashes in their 60s and may want treatment, but they're not typically the ones that are going to be placed on hormone therapy primarily starting at that age. And the other thing is that when we're older, every year or 5 years, 10 years, we become less healthy overall. We are higher risk for heart disease. We get plaque in our blood vessels, our blood pressure. We start to develop high blood pressure, diabetes. So we start to develop more risk factors that increase our risk of dementia and also increase our risk of taking hormones, and their adverse effects like blood clots become more common as we get older, stroke and things like that. So number 2 from the observational studies, they found a protective effect from estrogen therapy and basically neutral effect from estrogen and progesterone therapy. Third point, probably a sweet spot to initiating hormone therapy. Just like if we were using menopausal hormone therapy for vasomotor symptoms and we're looking at other risks of the hormones like breast cancer and things like that. So when we look at women that are 50 to 59 who are in the first 5 to 10 years of menopause, we are not seeing the risks of stroke, heart disease, heart attacks, things like that. There is a slight increased risk of blood clots. Some studies show a slight increased risk of breast cancer, but in general, those risks are going to be much lower in that newly menopausal group versus women that are in their mid-60s starting hormone therapy. And in fact, when the studies were looked at, women in midlife or around menopause, basically, there was a 32% reduction in the risk of dementia in women taking estrogen therapy alone. There was also a decrease in dementia in women that were taking estrogen and progestogen as well, but it didn't reach significance. So probably a neutral effect there. And, the other thing to consider is that it may also depend on what formulation we're using as well. So there may be a decreased risk of dementia and other complications when we're using estrogens and progesterone, which are made by our body. So if we're treating somebody's symptoms, we've got them on hormones and they're taking estradiol, they're taking progesterone. These are things that our body is used to seeing. These are hormones that our body used to make versus Premarin or conjugated equine estrogens, which are estrogens that come from horses, and synthetic progestins, things that are not native to our body. So those were the main findings from the study, but I will put that information in the description on the podcast, and you can always look at that. I didn't print out the whole thing because it was like 30 pages. So, like I said, there are a lot of challenges with studying these things. And like I said, lots of different hormones. Every woman is different. Trying to wait and see if the hormones actually do what we want them to do. 10 years, 20 years, 30 years. We're waiting until somebody's 80 to see if they develop dementia from hormones that they took, from 50 to 55. Oh, the other thing the study showed was that there was more effect if women were on the hormones for longer than 5 years. So, there's just lots of little sweet spots and things we're still trying to figure out. But I think that if you are having hot flashes, night sweats, poor sleep, things like that, that's a big risk factor. And treating your symptoms so that you can do things that will definitively reduce your risk of dementia. So it's not just, oh my gosh, should I take hormones or not take hormones? And that's the only thing I need to worry about. One thing is that what is your overall lifestyle like? And that brought me to one other thing. Oh, shoot. It was a good point. Hold, please. Oh, that's the other thing in these studies. See, look. Brain fog, cognitive dysfunction, right here. The other thing is that some of these studies, women that will seek out hormone therapy for things that they perceive as being related to menopause, like brain fog, poor concentration, decrease in cognitive function. The fact that these women sought out hormones for their symptoms, it may be that these were some early indicators of dementia or Alzheimer's disease. And so maybe sometimes when women are seeking out treatment, it's not necessarily the treatment causing the increased risk of dementia, but it can also be, hey, maybe something was going on, we didn't know about it, and 30 years later, now we see what was going on. So that's another thing to consider as well, because there was a recent study last year that they did in Denmark that showed an increased risk of dementia in women that were taking menopausal hormone therapies 55 and younger. And that just doesn't seem real likely. And so maybe these women this was a study where they just looked to see what somebody's diagnosis was, and then whether they did use hormone therapy. I think it was from a registry, because I keep records of all this stuff. And again, cause does not equal effect, and maybe these women were really struggling with some of those neurologic symptoms, and that's why they were seeking out hormone treatment as well. So a lot of people in the Menopause Society here were a little bit iffy on that study, and I just don't see a lot of women at that age group with dementia, but we definitely see a lot of women with brain fog and sleep dysfunction and things like that. And a lot of times when we treat them with hormone therapy, they do get better and they function. We just haven't had a lot of studies that say, hey, if 1,000 women take hormones for brain fog, 50% of them are improved. And, we just don't have those studies. But I think overall, if you said, Doc, what can I do to reduce my risk of Alzheimer's and reduce my risk of dementia, there would be three things. One is your overall health. So anything you can do to improve your overall health. So in my mind, that involves diet. So not eating a lot of processed food, eating a lot of antioxidant-rich foods, things that are going to play into keeping yourself healthy. So whatever you can do to try to maintain a healthy weight, keep your blood sugar in a normal range, and just try to promote your overall health. The other conditions that can increase your risk of Alzheimer's and dementia, like I mentioned, diabetes, high blood pressure, being overweight, heart disease. The other thing is, why do women get Alzheimer's more than men? And there's the thought that we live longer, although unfortunately that gap is closing. We've got a lot on our plate as women. We also tend to have more autoimmune disorders, and Alzheimer's is probably an immune disorder to a certain extent. So maybe that's part of it as well. But unfortunately, I think the life expectancy gap is just closing up. And, I don't know if that's because just there's a lot of stress on us, and we're working, we're raising families, we're caretakers. We are not taking care of ourselves as well as we should be in the midlife. I know that firsthand. And then along with that, trying to keep the healthy lifestyle. So maybe I wouldn't say number one is diet. I'd say number one is keeping a healthy lifestyle, and that's going to involve diet. The other thing it involves is getting off your ass and moving. Have you heard that saying that being sedentary is the new smoking? Well, I think it's true, because we sit so much, we're not as active, and it increases our risk of everything. Same thing, I think about that with breast cancer and hormone therapy as well. That, if you're taking hormone therapy, there can be a statistical increase in risk of breast cancer. But if you're not moving and you're not exercising, that risk is even higher. And if you're overweight, obese, that risk is even higher. And it's the same thing with cancers, moving your other cancers, just getting up and moving. So staying healthy, getting off your ass, not being sedentary. Other thing, I don't really know that many people, I don't know anybody in my circle that smokes, but not smoking. Smoking's a big risk factor for Alzheimer's and dementia and everything. It just poops up your blood vessels, everything. Alcohol in moderation. Mentioned exercise already. Sleep and stress. I think those are big things. See, I said there's going to be 3 things. I don't know. I'm just going to list them all out here. I'm going with the flow. Sleep. Sleep is huge. If you think about it, you don't sleep, it increases your risk of heart attack, stroke, everything. Sleep is so important. And sometimes in menopause, perimenopause, it doesn't matter what you do, it's really, really hard to sleep. And it's usually not so much the falling asleep, it's the staying asleep. You wake up at 2 a.m., 3 a.m., boom, you're awake. And then, I don't know if you guys have ever seen that funny Wanda Sykes. I love her. She's hilarious. She's a comedian. Talks about how your mind races at bed. Like, what was my 3rd grade teacher's name? I really need to eat better. Where is my high school yearbook? And your brain just goes through all these things. Or you're thinking about the stuff you have to do at work. Or sometimes I wake up in the middle of the night and I realize, oh my God, I didn't call that patient. Or, I'm worried about something. And then your mind just starts racing. You just can't get back to sleep. And then when you do get back to sleep, you might have to get up an hour later. So sleep is paramount. And then stress. Stress can have a huge impact on your cognitive function. And if you're a 50-year-old woman, you have probably a lot of balls in the air. You are trying to work and probably take care of family, whether that's your partner, your kids, your parents. You're just trying to do it all, and you've got 8 million to-do lists running in your head, and sometimes it's just really hard to focus. And I think that's why we get so concerned that we can't remember a word, we can't remember where we put something. That's because there are so many circuits firing in there that just you can't keep track of everything. Or sometimes, like me, you think you're going crazy because you're looking for something and you just think you put it in the wrong spot. Then you go into the kids' bathroom and you realize that one of those little effers took it. And so you're not actually crazy. Somebody took your shit, and it's not cool. Anyway, other things to think about, stress can lead to mood disorders. And what can you do for stress? Try to exercise, get some of that anxiety off, walk, meditate, maybe need to see a therapist, maybe need to set some boundaries. I don't know. I think stress is probably the hardest one to get rid of because everybody has that and everybody has their own stress. Support. I think social support and intellectually stimulating activities are extremely important. And sadly, as we get older, a lot of times relationships and friendships fall to the wayside because we are busy. I have friends where we almost feel, sorry, I thought I heard something. We almost feel guilty going out with friends because we have a laundry list of things we have to do, or it's our day off and we need to do 8 million things, or we feel like we didn't get anything accomplished. But it's so important to make that social support happen. And I always tell my husband, I wish I had more of a chick posse. I have some friends, but sometimes it's really hard to reach out to people to form new relationships. So that's one of the things I'm working on this year. An intellectually stimulating activity. So go learn a new hobby, read a book, learn a new skill. Those things can help keep the brain firing as well. And again, sometimes we just feel like we don't have time for that, but it's important to make time for that stuff, especially as we age, because I think a lot of older people, they start losing friends to health issues, and that's really hard. And if your social support network is pretty limited already, losing your friends is really hard. So the other thing is, if you are perimenopausal and or menopausal, and you are experiencing brain fog and you're worried about your cognitive function, see somebody about it. Get your blood work done. There can be causes of these types of symptoms that are not menopause. And, I think we've tended to say, it's menopause, especially now because everybody is paying attention to menopause. Like, menopause causes these 34 symptoms. Menopause causes this. But I think it's really important to rule out other causes. Even if you haven't had a period in 16 months and you have night sweats, yeah, it's probably menopause. But there are other things that can cause night sweats, tumors, other medical conditions. So I think it's good to get blood work done. Check your blood count, check your thyroid, check your chemistries, get screened for diabetes, check your blood pressure, check for vitamin deficiencies, all of those things, because we are at higher risk for those things in midlife, and we wouldn't want to miss something that could be easily treated. So if you just feel like, I'm sluggish, I'm gaining weight, I can't function, I'm down, hey, it could be your thyroid. It's really common thyroid disease in women. Or if you are having some brain fog and cognitive dysfunction, you could have a B12 deficiency. I mean, these things I think are not as likely as hormonal shifts in midlife and menopause, but I think it's important to check all of those things before we just assume it's menopause. And I know I've been doing that a lot more in the office where, I always thought, I don't want to draw 20 vials of blood on you, or I want to be, a good steward of your healthcare dollars. But, I've just seen enough things that I think it's good to just check things, be like, yep, can't find anything else. It seems like it's menopause. Let's treat it. Let's see if it gets better. Or, if somebody's really got overwhelming symptoms, they don't get better with hormonal therapy or other therapies that we use, then it's good to see your general medical doctor and just cast the net a little bit wider and make sure you're not missing some other kind of medical problem. But, I think that is all that I have. I hope that you got some valuable information out of that and I just didn't ramble too much. To summarize, hormone therapy in the first 5 to 10 years after menopause may be protective for dementia and Alzheimer's if you don't have a contraindication. Some of our more natural formulas like estradiol and progesterone may be better. Progestogen doesn't seem to be as helpful for dementia. Probably neutral in women that are newly menopausal. And more importantly, take care of yourself. Sleep, mitigate your stress, get your regular checkups, try to keep your body healthy, healthiest weight possible. Keep the blood sugar in check, keep your blood pressure in check, get moving, exercise, take the stairs, get your 10,000 steps a day, do your 20 minutes of moderate exercise 3 to 4 times a week. Make time for yourself. You have to do that. And don't smoke. Moderate alcohol intake. So for a woman, that's 1 or fewer drinks a day. And sleep. Sleep. All right. I will see you next time. If you have any questions or comments, you can put them where those things go. That sounded kind of bad. Yeah. Go out and live your best life. Have a great day.